Okay, let's focus now on mitral valve prolapse. Now, in mitral valve prolapse, you have a prolapse or buckling of the leaflets into the left atrium during systole. Now, what does that mean? A prolapse is a prolapse. That doesn't really make much sense now, does it? Okay. So remember that blood is going to come into your right atrium. It's going to pass. It's going to go to your lungs, come back. It's going to go to your left atrium. Now, during contraction of the left ventricle, these little doors hopefully do something like this. So when pressure is, again, heart contracts, it's going to increase pressure, therefore these doors should close. Come up like so. Now in prolapse, we have a buckling of these leaflets. So these leaflets may actually do something like this. They will bulge up. They will buckle up. Okay. So again, heart contracts, this pressure comes up, causes these to bulge up. In some instances, this bulging may actually lead to regurgitation. So this door opens up completely and blood can come back in again. Okay, so that is if it is severe enough to cause regurgitation. That is what mitral valve prolapse is. Now, this is the most common form of valvular heart disease. The exact cause is unknown. Let's focus on some clinical manifestations. Now, for most patients, again, if we just have this bulging, it's not too big of a concern. Okay, so most of these patients are asymptomatic. No real clinical manifestations, no signs and symptoms. 10% of people, however, are symptomatic, and these patients are symptomatic because it doesn't just bulge, it actually opens up, allowing blood to come back up. So that would be more like regurgitation. But the things that you must remember for the Nclex is that in mitral valve prolapse, you have a murmur. Now this murmur increases during systole. The big thing is here, this clicking sound. The clicking sound is heard during mid to late systole. Okay, so make sure you remember the clicking sound because that's very specific to mitral valve prolapse. Okay, so if on the Nclex you see a clicking sound, right away think mitral valve prolapse, okay? Along with the signs and symptoms, continuing with our clinical manifestations, you worry about ventricular tachycardia. Now this again has to do more if there's some regurgitation. Again, if blood is actually pulling back up, the heart is going to have to pump faster to again keep up with the cardiac output. Fix the camera here. We were just talking about ventricular tachycardia. Patient may also complain of palpitations, dizziness, lightheaded, and again, the dizziness and lightheaded or being lightheaded has to do with the decreased cardiac output. Now again, the decreased cardiac output will be in more severe forms of mitral valve prolapse. Patient may also complain of some dyspnea, some chest pain. Now with these problems with the valves, you have to understand that the chest pain is not relieved by nitrates. Okay, so if you were to give something like nitroglycerin, it is not going to make the chest pain go away, which is very, very specific, because if we worry about something like an MI, if we were to give the nitrates, it may make the chest pain go away because you're causing vasodilation. You're getting rid of the constriction, thereby increasing circulation to the heart muscle. Here, however, it has nothing to do with the coronary arteries. Again, the chest pain has to be due to decreased cardiac output. So again, these patients will have no resolution of chest pain if you were to give them nitrates.